Patrick Ngechu. I'm the CEO of the Kenya Association for the Welfare of People with Epilepsy. So today we are here in Kisii County to celebrate the International Epilepsy Day, which happens every second Monday of February. And we have been doing some activities in the county, creating awareness and trainings and demystifying the myths and misconceptions about this condition. So we are privileged to be hosted by the county here, and we are here at the Cultural Center. We have just done the first premiere of a documentary that we have been doing for the past 1 year, in the year 2024. This film has been shown across the world in at least 17 film festivals across the world. And we are grateful that at least the community has accepted that the biggest problem that we have when it comes to epilepsy is stigma. And we are going to be ambassadors, and we are going to make sure that we talk about this condition. Remember that this condition can get to anyone at any age, and it is not a curse. And whenever you get it, there is a cost for treatment, and you can come to the hospitals. My organization has like 4 clinics in Nairobi, which takes care of about 25,000 patients. And we have had the experience. We've been around for about 43 years. So we know that epilepsy is treatable. We know that epilepsy is not a curse. We know that we just need to talk to our people, and we can help demystify this condition.
We will be able to reach more people, but the biggest challenge is to encourage those who know or have that condition to come forward and seek help. That can only be possible if the media steps in our fight against stigma. So I encourage the media to be in the front line, to be able to educate our people in the fight against stigma.
My name is Dr. Kenyi David. I'm the County Cancers and Non-Communicable Diseases Coordinator, Kisii County, and also the chair of the Non-Communicable Caucus in the country. This day we have come to commemorate the International Epilepsy Day, which usually commemorated such a day, and the basic message that we want to give to the community is stop hiding them. Stop hiding our patients, stop hiding our brothers and sisters who could be having epilepsy. We have treatment for them. We are able to manage them so that they can lead comfortable lives that are productive in the society. As a county, we are managing a big number of patients, but truth be told, those are not the correct numbers because of us hiding those.
Na mwathiriwa wa epilepsy, ningependa kuwahimiza wagonjwa wa epilepsy wenye wako nyumbani waweze kujitokeza juu kuna tiba na inaweza kontroliwa.
Mimi nilikuwa na shida ya kifafa, stigma ikakuwa mingi, hata shule nikawacha. Kaenda hospitali, nikapata madawa, nikakunywa kwa maagizo ya daktari. Ningewahimiza wale wenye wako na kifafa, enda hospitali, pate madawa ukunywe vile tutaagizwa na daktari.
Stop hiding our patients, stop hiding our brothers and sisters who could be having epilepsy. We have treatment for them. We are able to manage them so that they can lead comfortable lives that are productive in the society. As a county, we are managing a big number of patients, but truth be told, those are not the correct numbers because of us hiding those patients. Between 1,000 and 2,000 patients are seen in a year in our county referral hospital. But the question is, where are the others? We still have a big number hidden in the community. So the message today is to try and tell each one of us that if you have any patient who's having epilepsy, bring him out. Let him come and be managed. And it's possible here in the county because we have 10 centers already where we've established medical outpatient clinics, and we have dedicated specialists to be visiting those clinics once a week to see patients who have non-communicable diseases, among them epilepsy. And these centers are our county referral hospital, Kisii Teaching and Referral Hospital, Gucha, Nyamache, Nduru, Kenyenya, Iranda, Marani, Gesusu, Keumbu, and Iabe, sub-county referral hospitals. A patient should not travel from Nduru to KTRH for the same service. These services can be offered in those facilities. Hence, we reduce the burden of managing our patients as much as possible, because a patient will not just come for drugs. They'll use transport, they'll want to have lunch. All that put together is cost, increases the burden. And when we work together and tell them that there are centers that they can get the help near them, we are helping them to reduce the burden. Among the stigma reasons that we have in our community, either ni uchawi, ama amerogwa, all those reasons are not reasons for epilepsy. Epilepsy is a disease like any other disease. They have causes from infections or trauma or even a tumor or other diseases, even hypertension that has complicated. All these are causes that can be managed. So what we tell our community members, please